Recording, so if we get a good recording, this will go on our website in the future. So fingers crossed that the gremlins don't get us tonight. All right, let's bring up your guys' talk. For those of you at home, you are more than welcome to email me to get a copy of the slides. I do have a handout ready for you. Just send the email to sportsmedicine@mail.cho.org. We're just going to use the one on the computer.
Oh, we are. Okay. So do you still want me presenting over there? Or? All right, welcome, everybody. Okay. Okay. So my name is Dr. Eric Freitag, and I am the co-director with Dr. Cindy Chang of the Sports Concussion Program. So the three of us are going to present and then hopefully leave a lot of time at the end for questions. By completing this program today, by attending this lecture, our goal is that you feel more comfortable in the identification and response of concussion injuries. We're not here to teach you how to diagnose the injury. It's more about identifying when it might possibly happen and then how to properly respond. So with that said, I want to do a little thought experiment here. Chrissy?
We want to get rid of your face, number one. We're getting there. Trying to get it moving?
Yeah, the slide won't
Really?
advance.
It won't advance? Okay, that's all right. We're getting there.
Oh, there it goes. Okay.
Yeah,
All right, so let's do a little thought experiment here. So what I'm going to show you some videos, and I want you to pretend that you're on the sideline, and I'm going to ask you to rate on 3 different rating levels. High probability, meaning that you would take this player out for an evaluation. If it's immediate, so we'll say 90% certain you would take them out. That would be high probability. Medium probability is 50-50, and low probability, we'll say it's like 20% or less chance. You know, there's always a possibility. We're not there. We don't know what's going on, but just want to see where you're at. So we'll watch the first one here. There's a few, but I'm gonna fast forward through a couple because we don't need to watch. Still stopping.
Go, go!
Oh gosh! All right, so raise your hand if you say this is a low. These are probably 9 or 10-year-olds. So a low probability that you would take this player out, these players for evaluation. What about medium probability that you would take them out for evaluation? And what about high probability that you would take them out for evaluation? Okay. And let me ask a follow-up question to that. What's the probabilities, based on what you saw right here, that you would not allow them to return to play? So low probability, medium probability, so 50-50, high probability that you would not allow them to return. Okay. Let's watch another one. Video. There we go. Perfect. Oh, perfect. Come on. It's like a soccer sideline. Okay, finally the ref comes over. All right, so low probability that you would take him out for an evaluation. Medium probability. High probability. And what about not allowing him to return to play? Low probability? Medium? high. Okay. I should do some research to see if that we're divided between moms and dads, see if there's a difference. Yes, sir.
When you said probability, you like you haven't checked out to see if there was a doctor.
Well, what we're gonna, so this is assuming there's no doctor or medical staff on the sideline. Okay, let's watch one more at the very, actually two more. All right, so on that one, low probability that you would take him out. Medium, high probability. What about low probability that he would about returning him to play? Low probability meaning that you would, more of a chance that you would allow him to return. What about medium, halfway? And what about high probability? Like high probability would not allow him to return. So most people are medium. Was it medium? Or is, okay. All right. All right. One more here. Oh. Fast forward to the end here.
There's left
One more. Last one. All right. Low probability that he would come out for further evaluation. Medium probability, 50-50, he'd come out for further evaluation. High probability he'd come out for further evaluation.
The soccer players take them off the field.
All right, what about low probability? I probably messed it up, but low chance that you would keep holding him out, meaning that you would probably allow him to go back in to play. What about medium chance, 50-50, whether or not he's going back in? And then what about basically almost no chance that he would go back in? Okay. So hopefully at the end of this talk today, you'll get a better understanding of what we look for as clinicians when we're on the sidelines about how to better identify and respond to these injuries. So if anybody's watched Sports Center or read Sports Illustrated or just watched the news media, this statement here probably seen a similar statement very many times. So during the past 7 years, the practice has been too prevalent in allowing players to continue playing after a concussion. Again, this year this is true. Sports demanding personal contact should be avoided after a concussion, right? So this is, like last 5 years, 21st century, this is, you can't turn the corner without hearing about concussions. So it's like a new thing, right? So this is actually from 1937 proceedings of the 17th Annual Football Coaches Association. This is not new. We've known about the danger of these injuries, and allowing players to return too soon after an injury for a long time, going on 100 years now. Only now with more science and technology, better brain imaging, and better research, do we have a greater understanding. If you learn one thing from today's talk is that if you suspect that there's a concussion, you do not allow that person to return to play, because you'll find out why that can be dangerous. So what is a concussion? This is the same talk I give to a lot of physicians and other medical professionals, tweaked a little bit, because even amongst medical professionals, there's still a misunderstanding about concussions. So I basically break it down into 3 steps. There's 3 steps to be able to identify what a concussion is. The first step is you have to have biomechanical force, meaning that there has to be some sort of bump, blow, or jolt to the head, or the head does not have to be directly hit for a brain to be injured. Think of a whiplash or blast type. I've seen a doctor's report say, well, on a motor vehicle accident, for example, a rear end injury. Well, they didn't have a concussion because they didn't hit their head, but a whiplash injury can definitely cause a concussion. So think back to those videos. Was there a mechanism of injury for each one of those videos? Yes, absolutely there was. So we have the first possible condition meant for a concussion. So the next step then is that blow to the head must cause a rapid acceleration and deceleration, causing the brain to move violently inside of your skull. So your brain is the consistency of custard or jello. And I don't know why that's not, this animation here, but it shows the brain sitting inside. And your brain sits loosely inside of your skull. So what this animation would show is that when it rapidly accelerates and decelerates, your head moves and then your brain follows. So what's causing the concussion is that your brain is actually moving around inside of your skull, surrounded by that fluid. So this can be caused by either rotational forces, like getting punched, or it can be caused by linear forces, straight on like a rear end accident or something. Most of the time, most injuries in sports is oftentimes a combination of both types of forces. But this makes a difference because actually rotational type injuries tend to be more significant concussion type injuries. So we have the first two conditions, biomechanical force, a rapid acceleration, deceleration of the head, which causes the brain to move around violently inside the skull. And then our third and final condition is it causes a temporary disruption of neurological function. So what that is this disruption in functioning equals the physical and cognitive symptoms that you experience after concussion, which we will go through. So this is how a normal, healthy brain works. You have your normal neuronal function, which you want to do a behavior, and you have a signal, electrical impulse to the neuron, travels down the axon to another cell, and you get a release of neurotransmitters, and boom, you engage in the behavior. Well, after a concussion, a bunch of stuff happens on the molecular and chemical level that causes this molecular disruption or disequilibrium. So this talk alone about the cellular disruption in a concussion, we can talk for 3 hours. But in the most simplest form is you have a disruption of the chemicals inside of the brain cells, where you have intracellular potassium will actually rush outside of the cell. You have extracellular calcium ions rush inside the cell, so it becomes out of balance. And that out of balance is what causes the brain cells to have a disruption in their functioning. So when it's out of balance like this, this causes a metabolic dysfunction. Metabolic meaning how our brain, our cells utilize energy. And the brain is actually in an energy crisis because at the moment of impact, at the moment of the injury, you actually have a drop in cerebral blood flow. And blood is the only way that our brain is receiving oxygen and nutrients. Now, in order to get this brain cell back to its normal state of functioning, the brain needs energy to do that. It actually activates some pumps and channels and will get those potassium and calcium and other chemicals back to where they need to be so it's healthy equilibrium and healthy functioning. So it's during this period that the brain is extremely vulnerable for further injury and or stress, and that can actually cause potential cell death or serious cell damage. So when I mentioned that we learn one thing from this talk is to not allow athletes to return to play while their brain is injured. This is exactly why, because the brain is at exceptionally high risk towards re-injury when it is in this metabolic or chemical disruptive state. So this process may take many days for the nerve cells to return to their normal condition. And after several days, then after many days, it returns back to normal. In concussions, kids, adults, we heal from concussion. You just have to allow the brain time to do that. That's why I enjoy doing this work, is because the kids that I see, the athletes that I see, I get in the hospital, they recover with proper management. So when I talked about condition 3, that after the biomechanical force, rapid acceleration, deceleration, and then it causes an alteration in how your brain functions. We measure this or observe this by looking at how the athlete is behaving and looking at their sign, or having them report to us their symptoms and looking at possible signs for change in neurological functioning. So we can have physical symptoms like headache, fuzzy or blurry vision, nausea or vomiting. That can be a sign that you can observe. This is usually reported by the athlete. Sensitivity to noise or light, balance problems, feeling tired, having no energy. We can also have sleep disruption. Sleeping more than usual, trouble falling asleep, sleeping less than usual. There's cognitive problems like difficulty thinking clearly, foggy, feeling dazed or out of it, slowed down, problems concentrating or remembering new information. And it can also cause emotional or mood symptoms like irritability, nervousness, or anxiety, sadness, more emotional. I've seen it working on sidelines where a big football player gets hit and they're off and they're crying, and you ask them, why are you crying? I don't have any idea. I just got hit. And it triggers something in them emotionally. Now, some symptoms after a concussion will present immediately, and that's why you want to do that sideline assessment. We're going to go over that in a little bit. But some of the symptoms can be delayed as well. And the delay of symptoms is typically anywhere from a few minutes to a few hours, and maybe after a couple of days. I will tell you that the notion that you can have a delay of symptoms for weeks, and then all of a sudden start having symptoms, it doesn't happen. And I see it in the media a lot, where it's, I was just talking about a patient I had where it was several weeks of the person was completely functional, had absolutely no symptoms, and then just they started having a headache, and for some reason they tied it to a minor car accident about 6 weeks prior where it was absolutely completely fine. That's not how concussions work. You can have a delay of symptoms. Typically how it works is, say a football player gets injured on a Friday night, and they don't really feel too significant symptoms. They're fine over the weekend because they're just resting and relaxing, and then they go to school Monday when all the activity occurs and noise and stimulation. That's when it's like, whoa, they start having symptoms. So that's the kind of delay that typically we'll look at. But I do see it that an athlete will not display any signs or symptoms initially. The symptoms may appear within minutes or hours after the game, especially when you have adrenaline start to come in. And as I mentioned, so don't underestimate adrenaline or an athlete's ability, and I should say also parents' ability, to rationalize symptoms as something else. And you hear it all the time. Oh, they have a cold, so that's why they're experiencing a headache or something like that. And so they're trying to rationalize that. So let's talk a little bit about concussion action plans. So when you suspect that a concussion has occurred as non-medical professionals, what can you do on the sideline to ensure that this athlete is going to be managed properly? Because the management starts, the treatment starts the second the injury occurs. And so actually as parents and coaches that are here, you are setting the stage for optimal recovery and optimal management. Most of the patients that Dr. Chang and myself see in a specialized clinic are kind of the tip of the iceberg, where they're still really symptomatic after several days to several weeks. And I would say there's a very high percentage of the athletes that I see that the reason why I'm seeing them is because they weren't managed properly. And what that looks like, what does that mean when they're not managed properly? They either weren't identified, they rationalized the symptoms, they allowed them to go back into play, they allowed them to return to play too soon while they were still symptomatic and they get another injury. So there's a lot of things that can occur that if not managed properly, then it can cause a lot of issues in the recovery, delayed recovery, more severe symptoms, etc. So I don't know if I mentioned this yet, but if you suspect a concussion, you remove from play. Okay. So in all of those videos that I showed you, I would say if I have observed that, I would say it's 100% probability that I would pull them from play for further evaluation. And I would say it's probably a 99% probability that I would not allow them to return. Those videos in and of themselves alone were sufficient evidence for me to determine that there was a mechanism of injury, there was a rapid acceleration and deceleration of the head, and there was definitely alteration or changes in their mental status. And so what you saw there is each one of those athletes showed some sort of sign that they were not doing well. And that's what you had to look for. There was a soccer player that got flopped, went up for that header, and he was on the ground, and he was like this. Like that. That would be enough for me to pull an athlete. Yes?
Okay, you have here a concussion action plan.
Mm-hmm.
Okay, now as a coach, you're in a Navy,
Mm-hmm.
and I'm coaching volleyball now.
Sure.
Two girls go to the ball, they bang heads,
Mm-hmm.
and they both wobbly.
Sure.
Now, you have the fans in the stands yelling and screaming. When you take them off, you almost have to physically take them out of the gym, away from the crowd, to do it.
Right.
Now, if you're the only coach in there who's seen that day, that's almost impossible to do. So what you basically have to make a decision is probably just say, no, you can't do that.
Well, absolutely. Now, your index of suspicion as a non-medical professional should be very low. So I would say in those videos, for example, as parents or coaches, it would be 100% probability that they would not return to play. As medical professionals, you know, for example, I work on the sidelines of football games at Los Lomas, and I'm evaluating kids all the time. Every time I pull out a kid, it doesn't necessarily mean I'm not going to allow them to return. There could be other reasons. But if I was just a coach or a parent who didn't have any medical training, you don't necessarily need to make those decisions. If you have any doubt, you sit them out. So, but I'm also going to talk about ways that you can further enhance kind of getting an understanding of how they're doing on the sideline that's good for non-medical professionals as well. So you want to evaluate, so remove them from play, and then you want to evaluate for signs and symptoms of a concussion. And that doesn't necessarily have to be the coach. It can also be assign a parent to be kind of the concussion watchdog. For example, the hockey league in Tri-Valley, each team has a concussion spotter. It's a parent, and they've been trained by one of their dads as a physician who trains all the parents on how to do a very brief and simple sideline type of assessment if there's a suspected concussion. So this is a very good app. Almost everybody has smartphones now. I believe it's free. If not, it's maybe 99 cents. It's called Concussion Recognition and Response App. And what it does is it walks you through step by step how to do a sideline assessment for non-medical professionals. So for example, it will ask you a question: was there likely a blow to the head or body jerking the head? You ask, did you observe that? Yes or no? And they'll have all of the symptoms that we just went over that you'll actually ask the athlete on the sideline. Do you have a headache? Yes or no? Do you feel dazed or out of it? Yes or no? And it also has a brief and simple type of cognitive test as well to determine if there's any issues with memory. This just gives you an understanding of how they're doing. If you had enough suspicion that they might have had a concussion to administer this test, or this sideline assessment, then as non-medical professionals, they should not go back. If there was enough suspicion to have to do this, this is just for you to help determine how they're doing at that moment, to be able to provide that information to parents. Maybe you can email the results of this assessment to the parents, to the other medical providers. So it's a really good app to have. I would recommend all parents have it. So I don't know if I mentioned this or not, but I think I have. If suspected having a concussion, no return to play. If in doubt, sit them out. Do not allow a player to return to play until obtaining a written release from a licensed healthcare professional with knowledge in concussion management and care. So I'm going to pass the pointer over to Dr. Chang. It's on. And
So
she's
I'm going to knock it out of my hand, and then I'm going to run, do this lecture all over for you guys. Anyone know what I'm talking about?
Yeah.
Which is great, huh? That they got to run it. Okay, I'm going to stay right here. All right, these are my objectives for this part, and we're going to just jump right ahead into it. So thank you, Eric, for doing this. I'm going to give a case, okay? So we got an 18-year-old female soccer goalie. She comes into my office today for follow-up of wrist injury and also mentions that soccer ball hit her in the head during high school practice. She initially felt dizzy, foggy, cleared after about 5 minutes, so she continued running drills. She wasn't playing goalie because she had that wrist injury. She felt unusually tired and she took a nap after practice. When she awoke, she had a headache, which worsened as she tried to study that evening. In 3 days, she's playing against her high school rival. She denies having a headache today, and school was fine, right? Her high school soccer coach needs a letter for her wrist saying she's clear to play. Her coach and parents do not know about her headache. So, what do you think should happen? Since she's 18 and an adult, she doesn't need a clearance letter. She's an adult. She can just go back to play. B, she currently doesn't have symptoms, so she can play in the upcoming game. It's 3 days away. She doesn't have symptoms today. C, she needs to undergo a mandatory return to play protocol of no less than 7 days from today. And D, she needs to undergo a 5-day return to play protocol starting from yesterday, just when she got hit in the head. And E, I'm confused. Even if you are, don't be confused. So which one do you guys think the answer is? Think for yourself? How many people think A? It doesn't matter. We're not video taking this. Anyone for B? C? D? E? Okay. All right, the answer is C. The answer is C. Okay, so let's talk about that. I think the important things to talk about is this return to play protocol, 7 days, 5 days, today in the office, yesterday when it actually happened. Those are all things that are a little bit confusing at times. So Dr. Freitag talked about this window vulnerability, this metabolic crisis that's happening in our brains. The one thing, who would like to interpret this graph for me? Got a lady, I'm kidding. Okay. So what you're seeing is a whole bunch of chemicals that are being studied in the brain. But what I want you to focus on is this yellow line, which talks about cerebral blood flow. This is normal, okay, this x-axis. This is abnormal. So what's happening in the brain after a trauma is that the blood flow actually decreases. But the blood flow is decreasing as glucose demands are increasing. And what this mismatch is this metabolic imbalance. And so what's happening is when you need glucose to get to the brain the most to heal, you don't have the blood flow to take it there. And this was studied by Chris Giza and David Hovda, two of our UCLA colleagues. And essentially, sorry about the red, it may be unsafe to return to competition and brain activity until brain activity has returned to normal. So in rats, this is a rat study, that's about 10 days, okay? In rats, which kids, rats, sometimes the same. Okay, so this is what we're worried about. The other thing I want to make an impression upon you is just because you don't have any of these brain findings doesn't mean you're okay. And so many people say, well, my MRI was negative or my CT scan was negative. That doesn't mean anything from a perspective of a mild traumatic brain injury like a concussion that doesn't create these. So you've got your epidural hematomas, your subdural hematomas. These are problematic, absolutely, but you can have brain contusions as well. You know, I've had a Cal baseball player, took a baseball right to his head, skull, lost consciousness, less than a minute, had a bad headache, that was all, but we got a CAT scan that showed a contusion, but he had no other changes. I bring this up, meaning no other changes, no dizziness, no problems with school, no sleep problems, no balance problems, because head trauma can present in a zillion, and I mean a zillion different ways. And no two head injuries are alike, okay? And we see it all the time. A coach, a parent, a physician. Well, when I got hit in the head, la 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 la. You know what? You are not this person, okay? So, but just because you don't have any CT, MRI findings doesn't mean you're okay. Concussion symptoms, Dr. Freitag talked about, very much falls into these categories, which is helpful for us as we talk to people about concussion symptoms and how we manage them. But so many different symptoms can fit into here. Okay, emotional is a big part, which does affect people, and we will have parents say, he's not himself. She's irritable. More irritable than a normal teenager? Or preteen? Yes. Okay? Sleep is affected a lot too, but so many things, and so many things can be concussion symptoms, which is not a concussion. Right? You can have sleep problems that has nothing to do with concussion. You can have anxiety or, irritability, which has nothing to do with concussion. You have sadness. You can have a headache. It can be due to studying and bad posture, texting, right? So all kinds of things. All right. So a couple different things. Number one, all of us who are old in this room, you got your bell rung. You felt great. You went back in the game. You were fine, right? I trained like that 25 years ago. Bell rung, checked him out, sat him on the sideline, didn't have symptoms, we put him back in. Okay? Eddie George, I did Eddie George at Ohio State. I think he did okay. 2 Heisman. Did he win 1 or 2 Heismans? Eddie George, 2, right? No, 1. I should give him 1 too. Sorry. Bringing up Ohio State people. Grade 1 or D concussions. These colleagues of ours, who are now at Pittsburgh, basically did, these are high school football players, and they did baseline neurocognitive tests, meaning they were looking to see how well their brain functioned, okay, before the football season. Then after they had a concussion, they repeated these tests. And they didn't change how people managed them. But even the athletes who said they recovered within minutes of a concussion, I'm ready to go back. Coach, put me back in. I'm ready to play. Still showed abnormalities on cognitive tests 36 hours later, even though they swore that they had no symptoms, which shows you that no youth athlete recovers on the same day of the injury. Okay? Again, these were boys' high school football. Now, they then did a much larger test, hundreds of boy high school football players, and they did it and extended it out. And what they found was, in general, again, these are only neurocognitive tests. This isn't looking at other physical symptoms like dizziness or headaches or anything. This is just looking to see how well they performed in terms of how their brain performed. By a week, 50% were better by a week in terms of their neurocognitive functioning. 3 weeks, 80% were better, 90% were better, 4 weeks. Okay? What is this really showing us? The positive, people get better. Okay? The negative, sometimes it takes people a long time. Okay? Keep that in mind. All right, so because of these studies, because of many, 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 many more studies that follow these laws were passed. State of California, 2012. 3 parts. This is for high school kids. Education needs to go home with the kid during the PPE forms. Parents or guardians have to sign it. Kid has to sign it. I've read it. Number 2, if a coach, parent, whomever, official suspects someone having a concussion, you pull them out. Okay? And they can't come back until they have a written note. That was the first state law. Second state law, actually, let's go back here. 2012, Dr. Freitag comes to me and says, this is so unfair to the coaches. How can they recognize that a concussion has happened? We need to educate. And I'm like, Eric, I'm so busy. When are we going to do this? So we started collaborating and working together, and thank God the legislators did something correct, although we're going to question legislation, but 2013 they passed another bill, mandatory coaching education every 2 years. Who's a high school coach? Okay, sir, what do you have to do every 2 years besides concussion training now? Uh-oh. I don't know if it's just fine. Anyone?
Do the video.
Yeah, you have to do it. What other type of mandatory education is for high school coaches? First aid CPR.
TB test is
Sudden cardiac.
Sudden cardiac, right. So that's a health thing, but the education you need now is you need to watch or learn about sudden cardiac arrest. What is it? How to recognize it. You need to do first aid CPR training, and you have to do mandatory concussion training. All for a mere $800 a season, or whatever you get paid, depending on who you work for. So it's unfair to coaches. Absolutely unfair to coaches. Which is why you need to be proponents of having athletic trainers at your schools. Anyway, this is the education rule that was passed. And then the last one that was passed in last year, 2015, it limits your full contact practices. You limit your exposure. Hopefully you limit head injuries. Notice this is football. This is at the middle school and high school level. 90-minute practices twice a week. No preseason, no spring or summer contact practices. This is where this mandatory return to play protocol of no less than 7 days from the diagnosed date of concussion. Read that again. No less than 7 days from the diagnosed date of concussion. Why diagnosed date? Is because if a kid has a concussion on a Friday, the law, the senator, I'm trying to remember whose law this was, but the reason he proposed this is because he didn't want a football player going back to a game the next Friday, okay? The reason that was changed to diagnosed date of concussion is because if a kid got a concussion on Friday, we didn't want that kid to go to his or her doctor on Monday and say, oh, well, my concussion was last Wednesday, and then you count back. Does that make sense? It puts the pressure on getting them seen, and it's an access issue. But that is a balance, okay? And then return to play under supervision. Now, what's happening now? I want to throw these out to you. AB 2007, Youth Concussion Law. Working with the California Athletic Trainers Association and some other groups, will require amateur youth sports organizations, yours, because I'm assuming you're not in high school yet, right? Right? Okay. To adopt the same concussion laws that we talked about. Education, coaching education, return to play, sitting out, if you suspect concussion. That's what's being passed through right now, all right? I don't think it's reached Jerry's desk yet. Here's another one, neurocognitive testing. I actually just got an email that it is sitting on Jerry Brown's desk right now. So this is crazy. This is, sorry, that's my editorial comment. This is neurocognitive testing grant program. So if they can have the grants, they're basically going to ask school districts to apply to be site testing for neurocognitive testing. You have to give it to all of your kids, pupils, grade 9 through 12. You got to report to the County Office of Education the data, how many people you tested, how many people quit their sport after getting a concussion, blah, 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 blah. I don't know who's going to do it. I don't know who's going to give it. I don't know who's going to review it. And the only people that are going to do it are the schools that have a lot of money, already have an athletic trainer full-time, probably already have a neuropsychologist or team physician full-time who can do this. But they don't have the grant money yet.
Would that be like for concussion baseline?
Yeah, that would be like baseline concussion testing. Yeah, this would be probably the impact test. They didn't really specify. I will have to tell you that we have done impact tests, and we don't need impact tests to turn people to play or to hold people out of play. It's nice to have it. It's one little tool on our tool belt, but we don't need it. What we do need are people supporting coaches at events to help them pull kids out, to help them turn kids back to activity. We don't need money to be thrown into a test. This is where legislation is inappropriately, they're turning their attention to stuff that I don't think is needs to be. Okay, return to learn before return to play. This is key. So all this legislation, besides this one, right, was all about return to play, return to play, return to play. Our focus should be on returning kids back to school. So it's a problem, right? Teachers doubt you. They don't like accommodations. Oh my God, and you mean I have to let you rest? You mean I have to change my homework with you? Coaches are angry. You are weak. Why aren't you back in? Come on. When I got hit in the head, balance, I'm sorry, I don't mean to say coaches. I used to be a coach too. I just say that because none of you guys are this way, but some coaches are. Or parents. We can throw anyone there. Siblings, right? You've got a football player who's got two brothers who play football. You don't think he's getting ragged because he's not back on the field, right? Balance being at school versus home. Parents have to work. How can they leave a kid at home and not go to school, right? It's hard as a parent, full-time parent. Socialization, I mean, my husband and I would always go, Who's staying home with the kid today? You're sick. Rock, paper, scissors, you know? Socialization component of recovery. I mean, you're staying at home, you need to be with your friends. Increasing anxiety at falling behind in school. We see this all the time in our high school kids. So much pressure on them to do well. Loss of identity as an athlete. All of a sudden, you know what? They're not out there anymore. People forget about you. Cognitive rest. Let's talk about this real quick. Great study was done. They looked at idiot patients, you know, teenagers, young adults seen at a pediatric emergency department. One group, strict rest for 5 days, meaning you go in a dark room, no TV, no cell phone, no texting, no reading, just sleep. I'll bring your food in on a tray. Versus usual care of 1 to 2 days, like just chill. You know what? Let's just not do video games and TV, whatever. But you know, you can come out at dinner, you can come out and just feel comfortable, and then stepwise return to activity. Even if you have symptoms, will increase your activity. The neurocognitive tests and the balance outcomes were the same. Okay. However, what was different was those people with strict rest for 5 days, they had more daily post-concussive symptoms and therefore slower symptom resolution. Meaning, if you asked them what their symptoms were, they had more than the people that were doing this. Okay? Remember I talked about all the symptoms of concussion and how a lot of them leak into anxiety, depression, all these things? Perhaps there's some transition. I'm going way over. Acute management, am I doing okay? Okay. Okay, so remember, as Dr. Friga talked about, brain is in an acute energy metabolic crisis, right? So we've got to give this window anywhere from 2 to 5 days. We talk about relative rest. For example, when someone's injured with an ankle injury, we, as sports medicine physicians, I don't say don't do anything. I say, okay, you got to be careful about this ankle. We're going to prevent you from going back to activity. You're not going to be cutting and stuff, but I will let you get on a bike. You're going to do a lot of core work. It's strong, you know, from this perspective, and we're going to still keep your cardio going. So we'll put you on an upper body ergometer, we'll do some other things. That's called relative rest, right? We're not shutting them all the way down. So when we talk about relative rest of the brain, it's the same thing. We'll let you do a few things, but we're definitely not going to make you do that calculus homework. We're definitely not going to make you write that 10-page paper, okay? We got to pull them down a little bit. As I always say early on, chick flicks. Okay? I don't want you watching a Warriors game. I don't want you playing a video game. I don't want you doing Pokemon Go. But you can watch, you know, you can watch a show that's kind of mellow and all that kind of stuff, right? And not loud. All right? Cocoon therapy is not necessary and may do more harm than good, like we talked about that study. All right? Once symptoms are manageable, slowly introduce mental, physical, and social activities. I had a patient today. Are you walking? Okay, yeah, I am walking. How do you feel? Well, I have a headache. Is your headache any worse with you having walked that mile than when you started? No, it's no worse. Great, keep walking. Okay? As long as it's not worse. Generally, we start that about 3 to 7 days post-injury, and they don't have to be asymptomatic to begin gradual return to activities. I want you guys to know, though, is that we're not letting them do this in school, where they're not monitored. We're letting them do this stuff at home, where they can be monitored by families, okay? So this is an example, and I think we have some handouts for you, of a return to learn. This is a concussion care plan that we put together, but essentially it talks about examples of brain rest, rest from home activity, return to school, partial day, full recovery, okay? And we have an example of this. I think we have examples of this, and we actually have it on the CIF website too. For you coaches, CIFstate.org has some concussion stuff on it. And anyone can get on it, CIFstate.org. So after initial rest periods, slowly increase physical activity. Start with low exertion, walking, stationary bike, where you're not jarring your head, right? And slowly increase exertion as your symptoms start to subside. So then we've got return to play. That's all part of the concussion care plan. We have to be asymptomatic at rest and exertion. So when you're returning to play, we do want you to be asymptomatic, okay? Normal physical exam, neurological exam, neurocognitive function, usually off of all medications. I say usually. We'll let your physicians, we can decide that, but we don't like people that are on headache medication to go back into a situation where they could have a headache. because we want to be able to monitor. And they need to be medically cleared for a graduated return to play. And this is an example of the staging that we do. This is for California, reflecting the no less than 7 days. Okay, so it's staging, but it's a 7-step. And doesn't mean that every day you move on. If you've got any symptoms, you've got to go back. And sometimes you can spend 2 days at each stage. Okay, but this is the minimum, which is 7 days before you return back to activity. And notice it goes to limited contact, full contact before, because you want to make sure they can tolerate this before you go to full play, all right? So here, how many people that are slow to recover? These are some of the risk factors that are associated with delayed recovery, okay? Important things are they've had a history of a headache or migraine headache or chronic headache, learning disabilities, ADD, ADHD, any mood disorders, prior concussion history, greater number or severity of symptoms. So the higher they report what their symptoms are afterwards, they do have a delayed recovery. Loss of consciousness, greater 1 minute, post-traumatic amnesia. These are some of the risk factors. Now, some of these psychological factors enter into play a lot, okay? Depression, anxiety, neuroticism, they're better predictors of post-concussive symptoms than cognitive impairments, okay? So if they have a history of this, sometimes they'll have more post-concussive symptoms. You guys can understand why, right? Because they get more anxious. They get sad because this injury happened. They were doing great this year. And all of a sudden, boom. And all of a sudden, they're not that athlete that they want to be this year. It was their senior year. Concussion may precipitate an event leading to anxiety disorders. Sometimes that can lead into something that was underlying but not diagnosed until the concussion happened, okay? And then sometimes this happens too, right? We all know about this, suboptimal effort. You know what, I got a concussion, I can't do it. I can't learn this English, the way that I'm supposed to write my essay. Secondary gain, oftentimes I can't take the trash out. It hurts. Malingering. Now this is like, it affects us sometimes. I see adults as well, so I'm a family medicine, sports medicine physician. So sometimes, if people don't want to go back to work, I'll sometimes see that. But in terms of like, for kids, sometimes it's often that they don't even want to play their sport anymore, but this is a reason that they don't want to go back. So these are the things that we have to tease out, okay? As clinicians, and you guys help a great deal as siblings, as parents, as coaches. What can improve recovery? All right, this is a great study that was done. Essentially, they looked, these were concussion specialists, and looked at kids that came into their concussion clinic. And they found that if a kid is evaluated within 1 week of injury by a concussion specialist, their recovery was 16 days versus 36 days. For those who know statistics, this is very statistically significant, okay? Now, there's not a lot of concussion specialists, but what we can do is we can make more primary care providers out there knowledgeable about how to manage concussions. They need to know the rules, the legal stuff, they need to evaluate, okay? Pediatricians, family doctors, internists, etc. Let me start with that for now. We have put together some forms that we've been going out, especially after free time, going out to our primary care providers and community to talk to them about how to evaluate concussions. And we've gotten really great feedback about it. We asked, and this is kind of a checkoff, and actually all the docs at Children's Hospital now have made, you see that, they made a template on it, everything's EMR now. And so it really helps them in terms of looking at it. We've been giving them guidance then in terms of how to do that. We've also put together a concussion care plan, which is they look at it, they learn, and then they hand it to the parents or the guardians who then have this as well as a handout sheet, okay? We teach them about when to consider referral. These are some of the ones that we see. We don't see every acute concussion. We can't. We have other, Dr. Friedag is an outside practice as well, and I'm seeing ACL tears and knee sprains and, all other kind of back injuries, etc., as well as concussions. That's not all I do is see concussions. But if any of these things are happening, they may end up referring to us, okay? Well, we've had someone that's had 5 concussions now over the course of 3 years, so what do? Those types of patients. Did I put something out of order? I did. You got rid of it. You I thought I duplicated a slide.
Oh,
Dr. Freetag, let's go back here. Here's the second part of this study that they did. If the child reported a headache on the field at the time of injury, look at this, 23-day recovery versus 33-day recovery. Again, statistically significant. What this means to me is that this kid knew enough to say, I've got a headache. Let's educate more of our kids and teammates, coaches, and families about the various signs and symptoms of concussions. The coaches are now being educated at the high school level. It's going to happen at the youth level if this law passes, right? Families, you guys are here. We try our best to educate families, etc. We're going to be giving a lecture next month at another school. Hopefully a lot of families will be there. Teammates. Teammates are key. Because if you have a concussion, sometimes you don't know that you've had a concussion. But your teammate may say, she's not acting right. And I'm going to go tell the coach that she's not acting right, right? Because they've known about concussions. So, legislature education. These 3 states right now require concussion education for high school student athletes. Okay? I think it's a great idea. Let's do both. Let's educate our kids as well. Okay? So, that's my part. 2 minutes over.
Only 2.
Miracle.
I know, miracle.
That's a good question. But
Yeah.
80, 21, 27?
Yeah.
Strictly interscholastic, CIF level, not youth.
Nope.
Yeah.
Awesome. All right, so the last part of our talk tonight is by me. I'm Tom Fennell, I'm our head physical therapist here at UCSF Benioff Children's Hospital for the concussion team. So what I'm going to talk about a little bit more is kind of more of the persistent symptoms and treatment that we deal with. But I do want to touch base one more time on kind of the return to play. So a coach I know that's going to start coaching, their recommendation is either to come to this class or go to the CDC website. And so I was like, hey, I wonder what's on there. I haven't looked at it in a while, so I went to check it out. And they had a really, again, it's full of great information. In no way am I bashing the website at all. But they had a great return to play section where they listed out, exactly what their recommendations are. The first one, athletes should only return to sport with approval and under supervision of the healthcare provider. So it says they've been diagnosed. They know, they have a concussion. What's the next step? So that was one of the recommendations. Number 2, to enable, they should work with their team or their school athletic trainer to work on that graduated return to play. And then they went in and they talked about, exactly what is a return to play protocol. And they had a 5-step method. So it's already a little different than what Dr. Chang talked about. So, in California here, we have a 7-step that is on the CIF website. And a lot of the newer research has sport-specific ones that are also 7-step. The one thing I did like immediately was that their first is you need to be back to school before you can start any return to play. So they went through the 5, and I was like, all right, well, that's a little different than what I know. It's a little different from what I've read recently. It's not too different. And then I scrolled down to the bottom just to check. And the last time that the webpage was reviewed or anything was changed was May of 2015. So these next 2 slides are 14 studies that have come out in the past 6 months alone in regards to return to play. And so in no way am I going to go through these point by point because that would bore everyone and my brain's not that big. But I just think it points to the fact that so much is changing so fast as far as what recommendations are. What is the best method of care for your athletes? Okay, and so, it's just kind of overwhelming sometimes.
Thank you for putting these up. You see this challenge for Berlin 2016? So a lot of all these studies have trickled down from International Concussion Conference, which has been held in Zurich. Okay, so the next one's Berlin next month in October. And I couldn't get off work to go. But actually, so a lot of these, my colleagues, so basically there may be some newer stuff coming. So 5-step is what people have talked about. 7-step or 7, we don't like to say step, but the 7-day is because of California law. It's because of California law, which is why we changed it into the 7 stages. But this 5-step was introduced from the last International Consensus Conference. And so it'll be changed, it may change in Berlin, so we have to keep our eyes on the court.
Right. So again, it's just pointing out the fact that so much is changing so quickly. How can you, as a coach, who's got, regular job, family of your own, kids you have to watch on the field, read 14 studies. It's not fair to you. How can parents keep track of that? It's just not fair. So again, as a team, with Dr. Freitag, Dr. Chang, and myself, we're resources for you. So again, if he wanted you to remember one thing, I want you to remember another. And that is you can always contact us with any question for any information that comes up. And we're here to help you guys, whether you have athletes that are patients for us or not. So, how can physical therapy help? And, Dr. Chang had the lovely 4 boxes of kind of all the different areas that concussion symptoms fall into. As a physical therapist, it's right in my name, and I am very squarely in the physical portion of that. But we're looking at 4 key areas. And Dr. Chang, when we were first kind of developing the protocol for physical therapy, I talked a lot with her, and she thought these were the most important ones for us, where we had a great deal of expertise. And so we're looking at cervicalgenic symptoms, so what's wrong with the cervical spine. Vestibular, so balance, where you are in space. Vision and visual processing, how well you track, how well your peripheral vision is, all those things come into play. And then finally, the autonomic system, which is heart rate, blood pressure, your physical response to activity. So as a physical therapist, I'm here to help guide that treatment and address any dysfunctions we find through tests and measures, and then help with that gradual return to play. So, that's great. If you're on a normal recovery pattern, chances are you're not going to see me. More than likely, you may not see either of them either. Like I said, a lot of times we're seeing the kids that are having that prolonged recovery. And so for me, by the time you get to me, you're usually 4 weeks out, which is tough. You're already kind of a little bit behind. So the cervicalgenic symptoms, and I think this is one of the most overlooked contributors to concussion symptoms. And so without a concussion, there was a study right down here by Barron that looked at the anatomical structures in the cervical spine and the symptoms they can cause. So doing different nerve blocks and other things like that, they got headaches, dizziness, ringing in the ears, nausea, imbalance, hearing complaints, and eye and ear pain. Sounds pretty similar to a lot of those initial acute symptoms that come up. And then again, changes in just the joint position sense, eye movement control, how well you can maintain good posture. So a lot of times, when I'm seeing kids that come in after concussion, even sitting, they'll have sway. They just really are having a hard time controlling that. All of those have also been measured in patients with neck pain without a concussion. So, what are we doing when we find dysfunctions in those areas? We're looking at range of motion. We're treating range of motion. The first thing that we want to do is make sure you're moving normally. That is a key component. To do that, we might do soft tissue mobilization. We might have spasm in muscles. So for the injuries that Dr. Freitag was talking about, when no contact occurred, you had whiplash, your muscles get really tight. Everything tightens up to protect your neck. That can cause all the symptoms on the previous page. So soft tissue helps with that. Again, there might be mobilizations to the actual joints themselves between all the segmental vertebrae and neck that need to be addressed because you can be out of alignment. How many people have had a concussion or patients that had a concussion? Okay. So, how did it happen? Contact? Yeah, so I would say the majority of it, like the videos that I showed, were all contact. Do you think that trauma is not going to the neck as well? So, it's a good thing to remember. So other things we can do is retraining. So anytime you have neck pain, the main stabilizers of the neck actually shut down. And major global muscles start taking over. They're not designed for that. And it actually does not keep you in the best position. So we want to retrain them. So we call it, deep neck flexor training. Again, we give you exercises to take home. We're working on it in the clinic. Same thing, extensor training. They're dysfunctional now. They're holding you in this position. You're all spasmed up. A lot of times you'll see people stuck here anyway. Really forward head, rounded shoulders. It's just not a good position. It's not working properly. Alignment changes, you can increase symptoms. So muscle extensibility exercises, really fancy way of saying stretching for your neck. So we do the soft tissue, we get things moving better. What can we give you at home to maintain that? Good stretching. And then finally, we do use muscle energy techniques to help correct that posture and train you out of that posture. So vestibular symptoms, lots of words. Basically, it's your positional sense. You know, it's the inner ear. And basically, in concussions, they've been reported to last, these vestibular symptoms have been reported to last years post-concussion in people that are not handled properly. And so it's very debilitating. You know, it affects posture. It will cause the dizziness. It will make you feel like you're moving when you're not. It works very closely with the visual system. So any interruption in signal or altered interpretation of the signal gives you completely a mess. They can't walk straight, they can't balance, and it's really tough. You know, so again, we need to look at this. We do some specific tests. There's one other specific thing that we look for with this. There are tiny little stones that develop in those inner ear canals. Those can get knocked out of place. If they actually get into the canal itself, it brushes against the hair, tells you you're moving when you are totally still. Immediate vertigo. You know, it's almost lights out sometimes. So there's some specific movements we can do to test for that, and specific movements we can do to try and get those stones back where they belong, and we use that feeding for you. So we do a lot of balance exercises, first and foremost. I think every patient I've seen come in with a concussion has done very poorly on our testing measures initially with that. And it's one thing that we can get a measurable data for that basically allows us to compare time to time, visit to visit, week to week. They do, like I said, the eye, the vision, and the vestibular system work very closely together. So we need to make sure that those signals are being interpreted correctly. So we are making you do eye movements and then head movements. We're retraining the brain to interpret everything coming in the right way. So, you know, again, lots of things with that. And so this is a good one too. So core stability training. And I was just talking to Dr. Chen about a patient I have currently has significant balance issues still, even though it has improved tremendously for the rest of his concussion symptoms. He's actually very, very weak as well. So a lot of times, you know, yes, the vestibular system, visual system give you input to let you know where you are. But if you can't hold yourself in a good place, you know, that's the double whammy, basically. And so then gait training, like I said, you get sway, you get funny walks, things like that, because they're just not feeling balanced. You need to retrain that as well with different head movements. And then finally, if necessary, like I said, they can a little stone repositioning in there. The visual and visual processing symptoms. So again, high number of patients, 50 to 90% report visual processing issues or actual disruptions in vision, whether it's peripheral or not. Can you play a sport without being able to track a ball, without being able to track other players, without having good depth perception so you don't run into all these other players on the field, you know, make it to where you need to get to? It doesn't happen. You know, so again, these signals to the brain are getting interrupted, being interpreted incorrectly. You know, the eye muscles themselves are having a hard time controlling the focus. So again, what are we looking to do? You know, we're looking to do a lot of specific eye tests that then lead into specific eye treatments for different movements. So fixation, can you actually just focus on a target? You know, whether it's near or far. So that's another good one. So a lot of times what we do is we'll get cards, little index cards, we'll write a word on that. One's held here, one's 5 feet away on the wall. You actually have to read the word on the card, read them on the wall, wait for it to come into focus, and then you go back and forth, and that starts retraining that transition from near to far. So pursuits, can you track an object? Can you go side to side? Can you go up and down? A lot of times what we see is they'll get a bounce as they're trying to track. Their system can't keep up with fast-moving objects. So saccades, can you pick two targets and look back and forth between them? You know, again, same thing can happen. They'll undershoot, overshoot. They just aren't able to pick that up and land on it perfectly. Virgin, so this is a little bit more of the depth perception. Can you follow something as it moves in towards you and keep it in focus? Can you follow it as it moves away? And again, this visual vestibular integration. So for all these things, we're doing how fast you're going changes. So obviously, in the person who's having a lot of visual issues, we're going to start off really slow. I use a metronome to keep track of that. So, hey, I want you doing 1 a second. You can speed that up to, hey, you're doing 1/4 second, you're bouncing back and forth. How long you're doing it for. A lot of times, patients I see, 4 weeks out, they can last 10, 20 seconds before they're starting to lose focus, symptoms are starting to increase. So again, and then down here, how can we integrate other things? And once they're able to do these in a stationary position, guess what? I want you to be able to do them while you're balancing. I want you to be able to do them with head turns. I want you to be able to do it, catch a ball, throw it back, look and find that target with that focus. So it's really important. So a lot of times when we get down to the sport-specific training, we're starting to implement, hey, can you catch the ball? Can you dribble while you're doing these other things? And so we try and incorporate that into our treatment. And then, so the autonomic symptoms. So, as Dr. Freitag talked about, and Dr. Chang talked about, the metabolic cascade that happens in the brain. So that cerebral blood flow drops. How does your body make up for that? It starts trying to pump more blood up there. It's not successful because the actual vessels constrict a little bit, so you're not getting that extra flow, but you're working harder to get that less flow. So it's heart rate increases at rest, heart rate increases with any activity. The way your body responds to input changes significantly. The heart rate variability, so basically, when you go to stand up, when you sit down, all those normal things that is regulated, isn't regulated so well anymore. And then again, like they talked about with that. So this is kind of the fun part for me because it's really nice. What we use is a heart rate monitor. So as long as my patient isn't on beta blockers, I make them order a heart rate monitor from home. And then we have one in our clinic. So when they're doing their walks, like Dr. Chang talked about, as soon as they get in to see me, we do a sub-symptom threshold test. So whether it's on the bike or on the treadmill, we're finding out what heart rate do their symptoms start to worsen. You're allowed a little range, but as soon as it starts to come up, our test stops. We get that heart rate, we calculate a range of 80% of that. So you can start in that range doing your walk, start at that range riding a bike, simple basic things. We start increasing the duration. So we want you to be able to do 20 to 30 minutes of activity in that range. It might be you only get to 10 at the start, but our goal is to build up to 20 to 30, and then guess what? We get to bump up the heart rate range, start over again, and build up again. So again, we're using that graded exercise. So for the patients that are 4 weeks out, that return to play protocol of 7 days is out the window. How do we get them to that point? We have to start here. And it's amazing. And one of the studies that I was reading, that I will say too, that recently came out, talks about starting physical activity, with walking, all those things, 1 to 3 days after diagnosis, because it actually shows that it helps with the metabolic cascade that's going on and helps the healing process with that. So I think, as more research is done about that, it's actually going to show exactly what they talked about, where that strict rest, locked in a room, isn't the best for them. So,
Or a football trailer.
Right. Yeah, that was that. Or a closet. I've heard that one too. I got stuck in the closet for a while. So again, I think the main point of this, A, so you know what we do when we see your athletes, but B, it's why should you kind of integrate us? Yes, we're great. You got this lecture. You're going to get credit for your education, which is fantastic. But again, we're a resource for you. As a team, Dr. Chang and Dr. Freitag are going to be able to determine where you land initially on that scale. Hey, are you ready to go for that return to play? Do you need some PT? Do you need to go see Dr. Freitag? Do you need to come back and check in with me before we get that started? Again, we give that guided increase across all activities. Dr. Chang handles return to learn, return to play, with recommendations from Dr. Freitag. Dr. Freitag can refer to Dr. Chang if there's something that he thinks needs further looking at. Same thing for me. I get patients from both of them all the time, which is fantastic. And again, we're happy to work with any coaches. We're happy to work with athletic trainers at school, because guess what? They're going to see you fit every day at school. I'll see them 2, maybe 3 times a week at most. Dr. Chang will get them in once a week if they need it, twice a week. So again, it's one more kind of step to make sure your athlete's getting the care they need. And then our goal is always to return the athlete as quickly as possible, but as safely as possible. So again, we talked about all the changes in the research. It's changing all the time. So for us, it's our job. So definitely use this as a resource. Okay. And then we have any questions for any of us? Yeah.
Nutrition is the soccer and heading the ball, and so that's repeated use, and we're trying to make that an issue, and then also with some of the headgear that's coming out now, beneficial and
So, for me, the headgear one, I think right now, as far as concussion goes, that's realistically the helmet headgear to prevent trauma to the skull. And it's like Dr. Freitag talked about, your brain is encased in fluid floating inside the skull. The helmet's not around the brain. If you have that quick whiplash injury or that hit, the body jerks, the brain still smacks the inside of the skull. Are some of the forces from that dissipated by the helmet? More than likely, but is it going to stop the concussion now?
So U.S. Soccer has new guidelines as far as heading is concerned. If you're under 12 or younger, you're actually not allowed to have the ball. So you're at pre-K. You're not even staying allowed to be coached.
Wait, could you? So she had a soccer tournament this weekend, and she's 10, and there was heading everywhere, and the parents were all like, "Wait, we knew they couldn't coach it, but we thought it was improper for them to do it."
Direct free-K for the opposing teams. It's new for the referees too, so some are going to miss it. So I would recommend that if you do see that and the referee's not, I was just at a game last weekend to happen, as like, and then the referee's like, oh yeah.
This is U.S. Soccer.
But like AYSO, for example, basketball,
Yeah, it depends on who's adopted it.
if it's a completely unaffiliated.
Yeah, there's factions, you know.
So it's just like a CYSA team,
She
basically.
plays for Mustang in Danville.
Yeah, so they would definitely fall
Well,
into those
but I
guys.
even asked her coach, and he said, "Yeah, we can't coach for it, and I will discourage it." She's had it for a long time, but he's like, "We can't." He's like, and he was saying he was feeling like there was a difference between having a throw-in versus definitely
But
can't
at 12
hit.
and under, it doesn't matter. So the rule is now U.S. Soccer, and that your coach should absolutely know this, and this is why Dr. Chang mentioned it's so important to have concussion education. But this is actual rule that referees are supposed to follow. So headgear really hasn't been shown to have any proven effect to reduce concussions for those exact reasons. So it's not something that we recommend. The counter argument is, well, what harm could it do? It actually can do harm. You can get what's called risk compensation, where athletes that are more protected or athletes in the population as a whole can take greater risks. And so you could potentially take greater risks and have false sense of security that should be afforded.
You guys go to iSearch? Do you guys have to do iSearch in your schools?
No, I don't know what that is.
You know what that is? Okay. It's a big project you have to write in middle school.
She's okay.
Well, eventually. Keep your hand up.
I coach at the high school level. I coach lacrosse, and we have a 7-day protocol. They're actually really good, but our players are starting to figure out how to kind of skate that 7-day with their pediatricians or whatever. It's just basically how you look fine and clear after that 7 day. Is there a way to use you guys as a second opinion for these players?
Yes. Yes, but that's the pediatricians are breaking the law.
Right. I mean,
Right? I mean, yeah. I say that loosely,
Right.
right? Who's enforcing it?
Right. Exactly.
But they're not intentionally.
Because
they're just
symptoms aren't
unaware.
But they're not.
Yeah.
Still cognizant of lingering.
Right.
And and I think a lot of these players are trying to
So-
kind of keep this in.
So they're kind of unaware because if what they have to do is really know how to diagnose a concussion,
Right.
and if a concussion happened and their symptoms went away after 2 days, oh, sorry, you mind me stand here?
Oh,
Shake the mouse.
Shake the mouse. Shake the mouse. Where's the mouse?
Just take the space bar.
Oh, got it. The crying baby.
Yes.
So it's really the pediatrician or the family, whoever the physician, the person evaluating didn't really understand that they had a concussion. Because it doesn't matter if they, just like that first patient, so they had a concussion, they had symptoms, they were tired studying, they had a headache, but by the next day it seemed like it resolved and school was fine. And they wanted to play in a soccer tournament or soccer game in 3 days. It doesn't matter. They've had a concussion. The day they were diagnosed, from there, it's 7 days before return to play. Okay? So I think that you, as a coach, since you know the law, it is imperative that you're saying, you're able to either contact your athletic trainer, the parent, or you go back and you say, I'm sorry, I know you had a concussion, I thought you had a concussion. If the pediatrician said they had a concussion but they're cleared, then that's obviously they're not aware of the law. And there's a lot of doctors who aren't.
Well, they're being diagnosed with concussion.
Then perfect.
But they're not, they're still having symptoms.
Yes.
They're not telling,
Yes. So the answer is yes. Yes, you can say, I am not comfortable clearing, letting you back on the field.
Even though they're clear.
Yeah, I'm not comfortable letting you back on the field.
What's your headache?
Right. And say, oh, I don't have a headache, but
If they,
teammates say, oh, she didn't look right.
they
Right.
don't look right, they're uncomfortable.
Right.
When it comes to proper concussion management, it's like a good marriage. You have to have, you have to have 2 yeses or 1 no. With concussion management, it's like 4 or 5 yeses. You have to have the doctor's yes, athletic trainer's yes, coach's yes, parents yes, and sometimes athlete's yes. A lot. Should be athlete's yes as well. If you get any one of those that say no, then it's a no. So you have to have that follow. So the coaches absolutely. You know your athletes. We don't know your athletes. Your pediatrician sees your athlete once a year or something. If you still get a sense that something is off, that's then well within your right to say, no, I'm sorry. And get this one thoroughly explored.
I have a funny story. Patient we were talking about earlier today, and my son, long hair is the whole craze for boys, like and man buns and stuff. So I've had a couple people, and the patient we share, long hair, right? Long hair, doesn't keep tie it back. It's like this. Well, in order to be able to see, you've got a whole, he's like doing this, and so now I know the reason to get my son's haircut. He's getting a concussion. I'm just saying that there are certain things that we talk about this, but we need to be really, really cognizant of the fact that, number one, people are going to get better. Number two, what can we do to help them get better? And part of it is, number one, in the very beginning, we say, you will get better. If you don't say you will get better, they are mired in this, oh my God, what's going to happen in my career? Oh my goodness, I know Joe, and Joe Joe took 3 months and his mom held him out. Or, oh my goodness, and it's just, I can't deal with this, I'm going to be behind in school. And a lot of times we say, think of it in terms of if you had mono. If you have mono or really bad flu, you're not going to school for a week, and you will be behind. But what happens? You know what? The same thing with concussion. We're going to manage you like this is an injury or illness that you can't go to school, and we will get you back and caught up. And there will be times, and I tell, unfortunately, I know a lot of people that have concussions. And there was a kid that I treated, and she ended up going part-time through her junior and senior year of school. Part-time, mind you. And she's at UCLA. You are not destined to not go to college or not do well because of this, but we're going to manage it appropriately. Okay? You just got to focus on positive.
So after your kid recovers from concussion, is it easier to have another? Or once you're healed?
That's a great question. And so if you look at a lot of studies, a lot of the studies say, yes, once you've had a concussion, it's easier to get your second one or third one. And a lot of them weren't that controlled to say, well, wait a second, were they totally healed after that first concussion before they got that second one? And we do know the ease of how it is when you have a concussion you don't resolve. And we've all had cases of this where someone, we waited whatever, and the next time they got a concussion, it wasn't even as hard as the first time. They were just setting a pick, and boom, and that happened. And so that's a really tough one because they haven't had all the parameters looked at when they say that. Now, we will say that there is a concept called functional brain reserve. Like, if your brain has had a concussion or seen a concussion and they've recovered, though, does an insult cut? Is it sensitized? Is it more sensitized now than another insult? But I have to say, we've all seen patients, again, who've had 5 concussions. They've all resolved quickly. They've gone back. They've had big hits. Nothing's happened. We're following them. But then it's something that causes another one. So everyone is different. Everyone is unique. So it's really hard to place that on someone. What we do try to say, though, is we definitely want to make sure that if someone has come in with multiple concussions, that we make sure that they are transitioned back slowly, that their symptoms are all gone, et cetera, et cetera. We are definitely more cautious with patients like that. There's no question about it. And we talk about reducing risk. We talk about, you know what, let's not play all contact sports all year round. Let's take a break in the summer and swim. Don't backstroke. I'm just kidding.
Exactly.
Yes.
So you keep saying that if you have a concussion, you can't go back until 7 days. But I got hit in the head in a soccer game, but I don't necessarily have a concussion. So should I wait 7 days or?
Well, so if you
We didn't see her concussion, we talked.
Good question.
Yeah.
Good question.
So if you take a hit, remember I talked about earlier, you have a hit to the head, or and it causes your head to bang around,
Fell backwards.
fell backwards, hit the ground. So that's a rapid acceleration and immediate deceleration with your head hitting the ground. And then you feel any of those symptoms,
She had like sensitivity.
then that could have definitely could have possibly been a concussion, and so then have to be managed.
But I think that's the hard thing, especially for her, for any kid to struggle with, is, like my doctor said too, there's no longer grades. I think you used to give them grades. And so for her, I know she feels like I'm fine. Like she hasn't had a headache, and she's been at school, and she's doing everything she needs to do, and she's been fine. So she's frustrated, which that's obviously very different than like my daughter's friend who got hit by a softball in the face and started wandering around the field not knowing where she was, and did dark room and had all kinds of sensitivity for days.
So I never say whether a concussion is mild, moderate, or severe as far as like, oh, it's a mild concussion. Concussions, it's like being pregnant. You're having right? And so, but what you can say is that the symptom expression is pretty mild. So does that sound like a possible, there's a mechanism, the rapid acceleration and deceleration, she had some symptoms. So that sounds like that's a definite possibility without having evaluated her or anything like that, just talking general possibility. But the symptom expression certainly seems pretty mild. So then we have less concerns and less restrictions for management. It's not every kid needs to, stay home from school for 2 days or 3 days after concussion. By the next day, they feel completely fine. They say, let's try it, see how it goes. But it does need to be managed.
Right, and the fact is that you can still go to practice, you can still progress in your activity level, you just can't be exposed in situations where you're going to get hit in the head. Does that make sense?
Not really.
Yeah, well, here's we're not your physicians, correct? And the 7-day law doesn't apply to, right now, people less than high school. That 7-day mandatory return to play, no less than 7 days, was legally for high school kids. Now, as a physician, did I always manage people that way? At Cal, did I manage people that way? No, but is it bad to manage people that way? Is it conservative? Is it good for overall long-term health? Yes. It's a game of soccer and you're, how old are you? 10.
How many years you plan on playing?
Till Monday.
Well, there you go. So that is a hard thing for us as adults to try to tell kids, because us as adults feel the same way about things sometimes. But the fact is that if you were to get hit in the head again and you were out the whole season, how would you feel then? Really upset, right? And that's what we emphasize.
So before we answer any of the questions, why don't we quickly do our raffle, just in case anybody has to go. So if you RSVP, you're automatically entered into the raffle. So we have some fabulous prizes.
Fabulous.
So we'll do the back.
Backpack for our first one.
Margarita, Minor, Bobera. Not here, all right? Mona, starts with a B. No.
You have to be here to win, right?
Yeah,
And this is registered in person, not webinar, right?
And Maria Mercado.
They're all M.
All right, so the next one is for a DVD. And this is a DVD called Head Games. It's a documentary put out by somebody Cindy and I know very well, Chris Lewinsky. It's a very good documentary. So Wendy Chang.
You guys remember Vanessa is one of our physical therapists. She's at our Oakland site, and she works with our kids with concussions as well.
Cindy Chow.
She's online right now, too. She is. She wins.
She was entered the
I will
DVD.
find her a way to get
Okay.
the DVD.
All right. Congratulations.
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 Phil Manoni. All right.
There you go.
A T-shirt.
Size small.
Actually,
small.
we can get yeah.
Small. I run a large.
So large, she's
There's an
kidding.
extra large in there.
I run a large. If you need
We have an extra large.
All right, and this final, the grand prize is either a free motion analysis in the sports performance motion analysis lab, or a free running analysis, or if you really don't want any of those two, then you can just probably dig up another T-shirt. But the motion analysis, those are pretty good. So. David Kemp.
David Kemp.
Right.
No one pretended they were David Kemp because we're not checking IDs.
Great.
Claire Andrews.
See, there you go.
Diana Redden.
If you know any of these people, tell me.
You guys are RCP, right? Jean Kalin. So, leave your, leave your information with Chrissy, and then you guys can. What would you recommend? Coach by soccer, probably.
I would do a little for you. I would do a lower body movement.
Absolutely.
We were gonna bring myself in for the running.
Oh, perfect. You can double up.
We just do one of our teammates too, so perfect.
If you, there's some more questions, so we can, if people want to leave or ask more questions, we can ask as a group, so go ahead.
Those of you guys are leaving. Thanks for coming.
Yeah, thank you very much.
Thanks.
Thanks.
My doctor said he'd do a baseline test, so I put that involved.
Does he do those tests?
Yeah.
Who's your doctor?
Dr. Tracy Tokyo.
No, so I'm here at Children's Hospital on Creek in Oakland. I'm at Medicine-UCSF, so I work at UCSF.
So are you here
Did anybody ask you?
Monday, Tuesdays here.
I think
If I just call
Yeah.
and then I set up the
Yeah. Yeah.
Oh yeah, don't forget your certificates. If you need
I
one.
told him I was coming
You guys need certificates?
Any coaches need certificates? Any coaches need certificates?
Oh, okay.
She's a nice girl. And she's good. She was done in Saudi Arabia.
Okay.
Another ice.
Oh, that's great. Yeah, I know.
Just this Friday, this past
No,
Friday?
no, in July.
Oh, July, okay.
It's not acceptable every
She wanted to go back because it's all of these Olympian coaches coming back.
She did not understand that?
To learn back.
Yeah.
It happened in the second half.
You hit the nose here?
or whatever.
Someone else's, because they were doing double and triple, you know, with their
Ready,
elbow.
got steps on.
And
Stand
then
back.
she was called and doing her job. And they happened on Monday, and then she took rest, and she said, I want, that's close to my axle, and I have to go back. So she went back to Tuesday for training, it ended there, and I happened on Friday. So 3 times happened to her. And she was, I was asking her, I was checking with her, do you feel
Yes,
worse?
that was.
Saying, tell me the number. And
Wait,
she
was
said,
Becker's
I'm
good.
feeling bad, I want to go
She went
back.
Kim.
Just cool for training.
How did you hear about this?
Oh, it's really just nice.
We're on, I think that
It's hard to ask a kid how they feel, so
And I didn't know.
when I query, I say, where's your headache?